Good day, I'm Samantha Jean Rojas and I'm going to perform nasopharyngeal and oropharyngeal suctioning. This procedure allows us nurses to remove secretions to maintain a patent airway, to facilitate ventilation, to obtain secretions to be sent to the lab, and to prevent infection. First, we need to assess the patient for clinical signs of restlessness, noisy respirations, change in mental status, the skin color, the pulse rate, the respiration rate, depth and rhythm, and the decreased level of oxygen. There. Then after, we need to identify the patient and determine for the patient's medical record for the if the patient is post-operative, we may administer pain medication, explain the procedure to the client even if she is unconscious, and of course we need explaining the procedure will allow her to know what is going to be performed, and reassure the patient may interrupt the procedure if she is experiencing respiratory difficulty. Then after, we may now perform hand hygiene by use of alcohol and or washing our hands. Then adjust the level of the bed into a comfortable working position, lowering the side rails, adjusting the head of the bed into a 45-degree or semi-Fowler's, and positioning the patient in a semi-Fowler's, or if she is unconscious, we may move her laterally facing us. But for now, she will be placed like this because she is conscious. So there. Then after, we will now obtain the necessary equipments, and such as this, the drape. We will now place the drape onto the client's chest, adjusting the suction machine into a appropriate pressure. The appropriate pressure for adult in a portable suction machine is 10 to 15 millimeters of mercury. If the suction is in the outlet, in the wall, it must be from in between 100 to 150 millimeters of mercury. So there. Then after, we may now obtain the necessary equipments, the working table closer to us, and adjust the level of the height of the working table. And now we will put on the clean gloves. First, now to prepare the suction and the sterile catheter kit. There. Using the aseptic technique, open the sterile catheter kit and get the sterile basin, and place it on the sterile field. The sterile catheter kit, the wrapper of it will be the sterile field. So now we will get the saline water and pour appropriate amount onto the sterile basin. Make sure that if you get the sterile basin, you must not touch the inner corners of it. You must only touch the edge of it. Now we will place a small amount of lubricant onto the sterile field, and we will now increase the level of oxygen of the client as per physician's order, as per order of agency protocol. Then now we will wear a mask, a face shield, and or goggles. Then after, remove the clean gloves and wear the sterile gloves, as we will now go sterile technique. will be the dominant hand, which is gonna pick up the sterile catheter kit, the sterile catheter suction tube, and the non-dominant hand will pick up the Y port and attach the tube endings. Then, now that the tubings are already connected, we will now test there. The suction tubing, we will now moisten it using the saline water, and now encourage the patient to take a deep several breaths. Ma'am, hinga po kayo ng malalim. Magsisimula na po tayo. Then, lubricate the cannula 2 to 3 inches. There. Then, insert the suction tip, reaching the floor, advancing it 5 to 6 inches for it to reach the floor of the nostrils down to the trachea and pharynx. While inserting, do not suction, do not place your fingers onto the Y port. There. Encourage the patient to take a deep breath, and the procedure must only last for 10 to 15 seconds while with intermittent suctioning. Then while withdrawing, rotate it. There. Then after, flush the tube onto the saline water. And now, the procedure must only take for 30 seconds up to 1 minute. And if the patient still needs to be suctioned, we may do so. It must it should be we must suction for only 3 times. Then after, we may now and then after we will remove the oxygen delivery device and Then after, we will insert the tubing, advancing it 5 to 6 inches for it to reach the floor of the nostrils down to the trachea and pharynx. Then apply intermittent suctioning there, and while withdrawing it, rotate it while withdrawing it. Replace the replacement of the oxygen mask comes first, then flushing the catheter, the tube. The maximum time of suctioning must be between 30 seconds to 1 minute. And there, we will now encourage the patient to breathe in, to take several deep breaths. Ma'am, hinga na po kayo ng malalim. Yan. Then after, we will now remove the connection of the Y port to the tubing, and we will now remove it and discard it. Remove first the dominant hand. The catheter, the tube must be wrapped onto the gloves. And remove the non-dominant hand. and discard it on the appropriate receptacle. There. So now, we may now remove our goggles and face mask, face shield. And now, we may now perform hand hygiene, of course, before and after the procedure, perform hand hygiene. So, there. Of course, turn off the suctioning device and there. Perform, of course, reposition the patient, reposition the patient to the previous position or to the comfortable position and adjust the level of oxygen if prescribed. And so for now, we will now evaluate the oxygen, the patient's response to the procedure, the note for the signs of clinical signs of restlessness, the adverse effects, the lung sounds, the patient's response, the respiratory rate, depth, and rhythm. Of course, document the following: pre-procedure and post-procedure, the suction catheter used, the route of delivery, the respiratory rate, depth, rhythm, the level of oxygen saturation of the patient, and the patient's tolerance to the procedure. Thank you.